Hi, it's Mayor David Stahl with another edition of Business Spotlight. I'm at the MedExpress located at 418 Route 18 North here in East Brunswick, and I'm joined by Paul Legou, one of the area district managers for MedExpress. Paul, it's great to see you here in East Brunswick.
Welcome, Mayor. We're glad to have you here at MedExpress in East Brunswick.
Let's talk first about the corporate structure of MedExpress and give a little history about your business.
MedExpress started in Morgantown, West Virginia in 2001. A group of ER physicians who worked in a trauma center quickly identified a need for people to have easy access to affordable, quality health care. And long story short, MedExpress was born from their vision from 2001 and has grown to 130 plus locations strong today and more to come.
That's fantastic. Why did you choose East Brunswick as one of your locations?
You know, East Brunswick and New Jersey in a whole, there's a definite need for people to have easy access to health care. East Brunswick, with a community of hardworking individuals, a lot of manufacturing, colleges areas, is definitely an area that needs access to health care. So that's one of the major reasons we chose East Brunswick.
And let's talk again about the particular services that you offer here at MedExpress.
You know, MedExpress, our locations are open 7 days a week, 9 a.m. to 9 p.m. We treat anywhere from injuries to sinusitis, from a cough to a burn. There's everything can be treated at MedExpress. We take x-rays on site. If you feel you need an x-ray, laceration or cut repairs if someone's hurt themselves working out in the yard. Sports injuries, workers' comp injuries. We offer some occupational medicine services for area business owners, such as urine drug screens, breath alcohols, wellness exams. A whole variety of different, there's injuries and illnesses that just about anything that we don't see. So.
When a patient comes in, what's their first procedure?
First procedures obviously is it's always welcome to MedExpress. We want our patients to be welcome and greeted into an atmosphere that they're going to feel their expectations are exceeded. In a true emergency situation, obviously they're immediately greeted by the nurses or the physician. Patients in the other process would go through a registration process, then go through a triage process, and then see our providers. Our goal is to have everybody in and out in less than an hour. 45 minutes would be ideal because we know people have busy lives and don't have time to be sick. So we want to get them treated very well, top quality care, and get them back to their lives.
When you talk about the triage, I mean, you're talking about your staff and nurses?
Yes, nurses, rad techs. Some centers have medical assistants, EMTs, paramedics, LPNs, variety, but they do the triage process, yes.
But at the end, the patient always ends up seeing a doctor.
Absolutely. All of our centers, especially here in East Brunswick, is staffed with a full medical team and always led by a physician. And at times we have mid-levels that work side by side with the provider, so physician-led, and sometimes we have physician assistants or nurse practitioners assisting them.
In your view, do you view MedExpress as a supplement to benefit the health community in the sense that as a patient, we traditionally use our own, what's called our family physicians, but obviously, as you said, the need to get to medical needs during certain times is difficult with our own family physicians. So is this a way of actually supplementing our normal physicians?
Absolutely. We are certainly proud to become a member of the medical team here in East Brunswick and surrounding areas and build those working relationships. We know how family physicians and primary care physicians and specialists even are booked, they're overworked, and we want to join that community and work side by side with them. So if you call your doctor's office on a Wednesday afternoon and they just physically cannot see one more person, we build those relationships and they say, go down to MedExpress on the highway, and they know that their patient's going to get great quality care, and they're sick, they need to be seen then. There's no appointment ever needed at MedExpress, and they can just walk in and be seen. Hopefully they've scheduled their follow-up with their primary care physician, and by the time they have that follow-up, we have treated them. They are feeling much better. The records here have been provided to the PCP, and he or she is very happy with the services here, along with the patient is better, and that's our main goal.
And how do you handle the insurance plans?
Insurance plans, we accept or bill, a large portion of major carriers. We, do an online verification system and make sure what their benefit levels are. We always recommend that a patient know their insurance levels, what covers in urgent care and emergency care and their PCP and family care, that they know their plan inside and out. We're going to do, thorough registration and some patient education if needed, if they have deductibles, copays, those sorts of things. We do have very affordable self-pay rates. If a patient has no insurance, they're more than welcome to also be seen at MedExpress.
That's great. And obviously you must do blood work here as well.
We do blood work for our patients. If a patient is seen and the physician feels they need some type of blood work, we do the venipuncture here, and the labs are sent out. Unfortunately, we don't do outpatient lab services, but for the patients that are seen sick or injured and our physicians feel they need blood work, we can provide that service as well.
And if you could talk a little bit about, you pretty much describe a very wide breadth of services that you offer patients, but should anyone feel that maybe this is something MedExpress wouldn't take a look at it and for doctor services, what would you recommend?
Certainly, patients may not realize how sick they are or how injured they are. Everybody is welcome to walk through the door at MedExpress, and if they walk through, we're going to see them and we're going to take great care of them. If our physicians feel that they need a higher level of care, we will certainly triage, stabilize that patient, and involve EMS for transportation.
Again, you mentioned before your hours are 7 days a week, 9 to 9. What phone number can people contact the local East Brunswick office at?
East Brunswick location is 732-613-6168. We also have a website. It's medexpress.com, and we always encourage people to check out our website as well.
Well, Paul, I appreciate you spending a few times explaining your business operations here. It's not only is it full range of services that you offer. I mean, you've built a beautiful building here. It really makes patients, I'm sure, feel at ease.
Great. We appreciate you coming in, and we are so proud to be doing business, not only in the state of New Jersey, but here in East Brunswick as well.
Again, thank you, Paul. Again, we like to say shop East Brunswick, but here we're not talking about shopping. But should you have the need for medical services, please stop in at MedExpress. They're open 7 days a week from 9 to 9 here at 418 Route 18 North. Again, thanks for watching.